Hi, everyone. Thank you for joining today for this exciting session about evaluation for the funds. My name is Hannah Carliner. I'm the evaluation lead from HRIA for the funds. We have a great evaluation team. Megan Guptill is not here today, but you'll see with us we have Pri Rana and Stephanie Walker. So I'm going to talk to you about what is evaluation in the funds, what is our role, what is your role, but to start off, what is evaluation in general is what we want to sort of get our bases covered with. So evaluation is sort of how you know where you are. It's this roadmap for what you're planning to do with the project, and it helps you keep on track with what you think you're going to plan to do. So as you're thinking about the vision, mission, and goals in your initiative, as you're doing right now, as you write the RFP, you should sort of have in your mind that evaluation is a part of this. Evaluation helps you track where you are in meeting those goals. And so as you're thinking about these bigger picture items, that can help you think about what are the day-to-day activities going to be of your proposed initiative. And you really need that big picture perspective, especially if you're applying for a 5-year award, but even if it's a 3-year award, that's a long time that you're thinking about. And so evaluation is sort of a method to help you think about where you're at and what are the steps that you need to take to get there. And then you don't have to go into great detail in your grant application about the specific evaluation activities that you're going to propose, but it will help you to think about what are the mile markers along the way. So if you want to get from Boston to Berkshire County, are you going to go to Worcester? You can stop in Worcester on your way. How are you going to know that you are on your right track to get to Berkshire County? So the Centers for Disease Control and Prevention, CDC, defines evaluation as a systematic method for collecting, analyzing, and using data to examine the effectiveness and efficiency of programs. And so it is really the program work is what you're doing, and evaluation is the method to collect data related to that work to see, are you being successful in these little activities that you're doing to reach your goals? And are you being efficient? Or are there some things that you're doing that are not very much bang for your buck, and so you might as well shift towards another activity instead? So in this way, evaluation is also, this helps you with continuous program improvement along the way, which is very important if you're doing a 5-year program, because you don't want to put in all of these efforts and realize that they're not actually having any effect. So evaluation lets you measure things along the way to make sure that you really are on that road that you mapped out for yourself. We love evaluation, obviously, but many people don't, because you're just busy on the ground getting work done, helping to save the world in whatever way that you are. So we also want to convince you that even if it's a pain, evaluation is important. So it's important for a number of your stakeholders and people that you're working with as a form of accountability. So it demonstrates that you are using your resources responsibly. It can also, along the way, identify strengths and weaknesses to help you improve what you're doing. It helps you make informed choices, so that the decisions that you're making with your partners, with your community members, you can say, look, it looks like this method of outreach to our Portuguese speaking community is not working very well. This method seems to be working better, and you have the data there through evaluation to make that choice and to decide which method to put more energy into in terms of your community engagement, for example. It makes sure that you're aligning with your objectives and lets you measure the progress towards your goals, as I've been saying. It can also help you use resources better. So as I said, if something's not working well, stop putting money towards that, start putting it towards the thing that is getting you more impact for what you're trying to achieve. Evaluation also fosters a culture of learning in that it enables you to adapt and innovate based on the evidence that you've collected about how your program is working. It can build transparency so that you have the data that you can bring back to your stakeholders, partners, and community members, and help build trust by being transparent and showing what you're learning along the way. In doing so, it is also a method of community engagement in itself. So by collecting these data and then sharing it back with your community members and partners, that is a way of engaging stakeholders and increasing their involvement and support for the project. Also, data collection increases their involvement. So you might be doing focus groups that enable you to engage community as you're also collecting data in that process of meeting and having a group discussion. Talked about resource efficiency already. It can enable you to optimize your time, money, and personnel. And in some cases, it helps with legal compliance. And so you might have other grants in the future or other reimbursement programs, insurance, something, and it can help you with the documentation that you may need to provide them. So that's sort of background of evaluation in general and how it can be helpful. And now I'm going to talk a bit about our overarching evaluation approach with the funds. And so me and my colleagues at HRIA, we have sort of a number of roles. Our main role is that we're doing the overarching evaluation for all of the funds. So big picture, what kind of impact are the funds having in Massachusetts and in all of the localities in Massachusetts where they work? You all are responsible for designing and implementing evaluation for your own individual grants. So we are not your evaluators. There would actually be a conflict of interest for us to be your own evaluators. So when you're submitting your proposal, you should identify someone on your staff or think about hiring an external consultant because we can't do that work for you. However, we are here to provide capacity building and technical assistance to you all as you work on your individual evaluations. And some of this really stems from this embodiment of the values of the funds that we try to do, which, are the basis of community engagement, and community-centered evaluation and equity-focused and anti-racist evaluation frameworks, which I'll get into in a few slides ahead. So, but as part of this approach, we really take these principles to heart as we're conducting our overarching evaluation. And so we seek to co-design what we're doing, talking to awardees about what are the best reporting systems and the least burdensome. We really want you all to spend as much time as you can making change in your communities and doing the important work that you're doing. So we really don't want to burden you with too much written reporting, too much from our end. And we have a very trust-based approach as well. So we trust you all are doing the good work. But we do ask for some contributions to our overarching evaluation from you, but hopefully that is, capacity building and engaged in a way that works for everybody. So the activities that we do around evaluation are aimed towards building capacity, and then also creating actionable data for all of us so that the funds can continue into the future and other investments and resources towards policy systems, environmental change, towards anti-racism and health equity can continue in the future. So by sort of combining our efforts and everyone doing their own individual evaluations and then contributing to the overarching, our goal is that helps all the communities in Massachusetts by working together to get that data. So an overview of the team, our HRIA team, is that we do capacity building with grantees. We also do data collection for the overarching evaluation of the funds. We use what we learn for our own like internal quality improvement, and to, make ourselves more useful to you all as grantees. We're also trying to communicate and disseminate the process and impact of the funds, using examples of all the great work that grantees are doing. We have an evaluation work group, which if you have questions, I can tell you more about. And yeah, and just in general, we are responsible for the overarching equitable evaluation of the funds. From the grantee side of things, you all have a few responsibilities, if you receive an award when it comes to evaluation. So you're responsible for your individual project evaluation. When we onboard a new cohort, we lead a couple of webinars and then individual technical assistance to help you develop a theory of change that will really stem from the work plan that you've put together and your overall vision and goals for your project. Will then help you create an evaluation plan from that. Again, you should have your own evaluation team, consultant, staff, and your project, but we'll ask you to submit a draft, and then we'll provide feedback, so that you can revise and really engage all of your stakeholders and partners in that process. Yeah, so you're responsible then for sort of your ongoing project evaluation of your progress and impact. As you need, you will be assigned an evaluation officer in addition to your program officer, for the course of your award, and you can utilize that resource as needed. You can utilize evaluation office hours, and possibly along the way we will be doing some presentations, and so you can use some of your evaluation findings to either present publicly to other grantees, or like if possible going to conferences or things like that, and we'll see what happens there. We also ask you to help us with the overarching funds evaluation. And so this includes what we call virtual site visits, which are in place of submitting a large written report, that it's more conversational and discussion based, and you can bring community members, you can bring people to tell stories. And we really want to hear the stories of how things are going, what are the challenges, what are the successes. We're also going to be doing focus groups so the virtual site visits are your project team, and your partners. The focus groups will be combining different grantees together to talk about different topics, and that will help contribute to our telling the story of the funds overall, but it's also going to be a great networking opportunity and a great way to learn about what everyone else is going through, and hopefully help you solve similar problems or find similar inspirations. We do a bit of written surveys, with some survey questions and some short answer, as well as annual financial reporting. We use that for the evaluation team as well. But as I said, we are trying to be equitable. We're trying to not overburden you with that. So hopefully it's not too much. And then optional, you can participate in an evaluation work group, which has been really great. I think most of you have probably seen this at other sessions, but this is our racial justice framework that we use, this health equity. And so, we really think, I'm circling the wrong screen. Can y'all see my mouse here? So we really try to think of like root causes and the underlying systems and isms that create health disparities and health inequities. And so as you're all writing your grant applications, you're thinking about all of this as well. And we'll just encourage you. You don't have to be very specific about evaluation. in your grant application, but think about it from this perspective. And it's really hard to measure change in some of these things, but start getting your wheels turning about how you might do that. And we try to think about this as well when we're doing our evaluation, overarching. So in the RFP, as I just pointed out, the questions in the RFP ask you about your vision and mission. And so in doing that, you can think about, does your vision, in keeping with the health equity model, incorporate and embed community engagement, address social determinants of health and their outcomes, address root causes of inequity and dismantling structural racism, and supporting age-friendly domains, and prioritize health equity in Massachusetts. For all of these things, again, you don't have to get into the details, but think about how you might measure those, like how you might assess, how is our community engagement going? Are we reaching the populations we want to? How do we know which populations we're missing from our community engagement? Who are the hidden populations that we need to be reaching out to and bringing in? How will you know if you're successful at doing that? And then similarly with addressing social determinants, addressing health equity, how will you tell the story and show that that is actually what you're doing, that you are actually having an impact on equity in your community? The RFP also has a section talking about expectations of you. And so under evaluation, we say that the grantee will collect and report data metrics as developed in the evaluation plan and co-created by the grantee and HRAA. This is in our sessions helping you develop an evaluation plan. You will incorporate community engagement into these evaluation activities to measure changes in racial equity, and collect community level data. And then, as I said, we also say here that you will be expected to participate in some of the overarching evaluation activities, which we hope will be beneficial and fun and not a burden. You'll see another place in the application that we recommend using about 10% of your budget, of your proposed budget, for evaluation activities. And this could be staff time or consultant time. Also infrastructure needs, like if you need special software to do your evaluation or analyze data. And also we strongly encourage budgeting in for participant incentives. And so if participants are doing a focus group with you, you have an appropriate reimbursement for the hour or two that they will spend with you. So that's a very important place that is separate from regular community engagement. Like, I mean, it's an aspect of community engagement, conducting a focus group, but it might be more because it's part of that evaluation. So in thinking about working on your budgets and working on the details of your work plans, these slides will be available to you all, but these are some of the sort of typical evaluation tasks that you can think about budgeting for and think about building into your work plan. So meetings of the team, developing data collection instruments, whether that be, surveys to ask community residents about their ability to access transportation, their ability to get to appointments that they need, or discussion guides for focus groups. So thinking through the instruments and the questions that you'll ask of community members to figure out what specific help they need towards reaching your goals. You will likely need to develop some data tracking systems. Likely you'll need a bit more data than what you collect. Like if you work with individual community members, a bit more than what you would normally collect on like an intake form or a service provision form that you're filling out for them. You might need more space, software, translation services so that you can conduct focus groups or community engagement in additional languages. You'll want to be monitoring and collecting data all along the way and sort of building in time to report back to yourselves and make changes as the progress progresses. And then, this is maybe you can chat with an evaluator or an evaluation consultant or someone on your team about what kind of time and money might be needed for data cleaning, data analysis, and summarizing findings into reports. And also you might want to consider the various audiences that you'll want to share your work with. So a report to or for example, like you can use your evaluation to apply for an additional grant from another organization. And so what does that grant application look like versus a presentation back to your community to talk about the work that you've been doing? Those could be very different audiences for telling that story. So you should think about what kinds of who you want to disseminate to and how to continue to build community support for your work. How am I on timing? I'll go through this fairly quickly. So this is just to show you a bit of our framework, and we hope you use this framework as well, but you don't have to think about it in too much detail now. But for us, we really try to do equity-focused research and evaluation rather than traditional. So in a traditional model, we're the research and evaluator, we figure out some questions and we ask them of the community. The community answers the questions, and then findings are shared back with the powers that be. But if, where is my mouse? If equity is the vision, how would we do this differently? So we would have a community at the center who would be an integral part of defining the questions, designing the questions, and asked and answered, having the questions asked and answered in an engaged process. And those findings would then be used broadly to inform future processes and engage many audiences. So again, not just back to the funders, but also using what you find to bring it back to the community and improve your quality. So in this model, the community is the center, the research and evaluator and the funder and the grant maker are hopefully part of that community rather than outside and transactional relationship. This is another model that you all can refer back to from the slides, but thinking about not just equity and community engagement, but really explicitly how to be anti-racist in your evaluation approaches, which we try to do, and we try to gain as much feedback from grantees as possible to make sure that we are continuing to walk the talk and not just talk the talk. So I want to open it up then for questions and discussion. So first I'll ask if there are any questions, and then if not, I can pose a couple of these discussion questions to you all.